Harris. She has been a gynecologist since 1990, and for the past 20 years, she has been focusing her practice on specifically gynecological care as well as hormone replacement. She's helped thousands of women over her career, and I had the privilege of working with Dr. Harris before PA school, and she's one of the main women who has inspired me to go into OBGYN. So I do have a couple of questions for her.
Okay. Naturally is a field of where women do have to find someone that they can trust,
Right.
Because of vulnerability that's there. They interact with me, that they're able to feel relaxed, feel comfortable. And as I was sharing with you today, sometimes I feel like I'm a therapist because people feel so relaxed and so comfortable that they feel able to open up. And what's very important with that, as you mentioned some key points, listening. Far too often women's concerns are diminished, devalued. And part of it is the healthcare system because things are rush.
Right.
And they may need to have time to share what their concerns are and to express it in the way that they want to express it. There's trust that has to be there. So trust is huge.
Right.
Sometimes people don't see doctors, and especially African American women, population in general, because there's a trust factor that's there. So things sometimes are more comfortable when they see someone that looks like them, that may have shared some of the experiences. So of course it's listening. It truly is having a passion inside that lets them know, I want to help you, and I'm on your team to help us. Let's partner with this so that we can get you feeling and being the best that you can. So that being said, there absolutely is, cultural differences. There's going to be racism that's there. People are thought of in a certain way because of how they look, because of how they live, because, just automatic. We still have a choice and a decision on how we're going to govern ourselves, right? It may be a situation of like, okay, I saw this, but I don't want to be this way, so I'm going to do everything I can to not be this way, because this is what I saw. A doctor has to be able to recognize their own biases. So that's an acknowledgement of yourself and your thought processes. And they have to recognize that it's there in order to desire to do better, to change and to look. Now, medical education, I think, is getting better these days with cultural competency and things like that. That's part of the medical education. I think that if folks just kind of be attentive to recognizing their own, and that's probably the biggest thing of recognizing who you are and what filter you're seeing things through. But I do appreciate the effort in medical schools. It has to be across the board though. And I'm not just medical school, but any PA school, everything. I think that has to be part of the conversation. And things like this, where women can hear other women communicate and say things that helps them understand, like, oh, okay, I'm not the only one. I'm not the only one. So I think just broader education. I think every medical provider needs to find what they do. What can you do individually to help with that? I could stay in my office and just be closed and like, hey, whoever comes to me, but I'm big on going out and reaching out beyond these walls to make sure that I'm doing my part with educating. The providers they have to acknowledge themselves, educate themselves, know how to be competent in dealing with people. And then the patients themselves have to understand and advocate for themselves. Speak to one another and, go out and do the best that they can to help each other out. So
Dr. Harris,
you're welcome.
That was great.
Welcome.
Thank
Awesome.
you.
Yeah.
During my elective rotation, I had a meaningful conversation with my preceptor, Dr. Lysette, about preeclampsia and maternal mortality. She said cardiovascular disease is a common contributor to adverse outcomes, and Black women often present with pre-existing hypertension or diabetes, which can make management more complex. Extra time may be needed to ensure that they are heard and understood. Prophylactic aspirin for preeclampsia may be less likely prescribed due to underlying biases. However, there is also generalized fear and mistrust in the healthcare system that Black patients experience that can cause patients to be hesitant to seek care and follow treatment plans, contributing to poor maternal outcomes. To address this, providers can prioritize patient education, acknowledge fears, and remember that not long ago, unethical experiments such as the Tuskegee studies in the 1970s left a lasting impact on trust. Building trust involves explaining treatments such as aspirin for preeclampsia prevention, listening carefully to concerns, answering questions clearly, and creating a space where patients feel respected, supported, and empowered in their health decisions. I had a conversation with my cousin who's currently completing her OBGYN residency. She said, "One thing I noticed a lot during my residency is that Black patients often face delays or gaps in care. Their concerns may be dismissed, and preventative measures like aspirin aren't always discussed. This isn't just about provider knowledge, but medical mistrust, past negative experiences, and limited access to care all play a role. Taking the time to acknowledge fears, explain options clearly, and involve patients in decisions can make a real difference. Building trust through consistent and respectful communication and checking in regularly helps ensure patients feel heard and supported throughout their pregnancy."